Well, April is Stress Awareness Month, and if you've been feeling a little bit more stressed out than usual, you're not alone. One study showed in January, 84% of adults surveyed reported feeling at least one emotion associated with prolonged stress in the prior 2 weeks. Joining us for today's Wellness Wednesday is Dr. Sheila Giffen, Executive Medical Director for the St. Alphonsus Health Alliance. Good morning, doctor. Thanks for being here. All right, first question.
Good morning. Thank you, Matt.
Hi, welcome. So there have been so many reasons for people to feel, that much more stressed over the last year, of course. So what can living with that kind of constant stress do to you physically and mentally?
Well, a great question. Stress is actually a normal reaction, but over time, stress can cause some more chronic symptoms such as headaches, difficulty concentrating, fatigue, maybe some rapid heart rate, stomach issues, irritability, depression, difficulty sleeping, and many more symptoms.
Gotcha. Yeah, that makes sense. Now, when we find ourselves in that kind of situation that's filled with anxiety, other stressful situations, how can we make sure to change that situation ourselves and de-stress?
Well, really, Matt, the first step is to realize that, we're feeling stressed. So take a minute and recognize those symptoms, then take a couple deep breaths and assess the situation. What is it about this time period that I can control? So if we look at the pandemic, which has been a great source of stress, we can't affect everyone's actions or outcomes, but we really can tap into what we can do to protect ourselves, such as wearing a mask, social distancing, obtaining a vaccination, etc. And having a little bit of control can help us feel less stressed.
Gotcha. And of course, it's not just about de-stressing in the moment. What exactly does resiliency mean, and how can we learn resiliency skills?
Resiliency is really about bouncing back from a stressful situation. We've all been practicing those skills over the past year. In the setting of a pandemic, we can build resiliency through stress reduction techniques, healthy lifestyle, sleeping, exercising, healthy eating, and tapping into our friends and family for support.
Okay, gotcha. Now, my next question is a little weird because it's something we've all been wanting to do as soon as possible, and that's getting back to normal, I guess you can say. And as more people get the vaccine and we get closer to that, how can that be another cause of stress, and how do we cope with that?
Another really good question. Anytime we have a change, whether it feels like it's a good change, can cause stress. So what we want to do is really, again, tap into those resiliency techniques that we have learned, and then maybe even get a health check from your provider before stepping back and plan for it. Plan for that stressful period and know what you're going to do.
Perfect. And we're just about out of time. So for anybody that might have any other questions, where can they go?
Well, they can definitely check out St. Alphonsus for some additional resources. We have employee assistance programs, many online resources. And again, if you ever have any questions, please ask your primary care provider. They can get you checked out, make sure you're healthy, and then provide any other additional resources that may be needed.
Perfect. All right. Joining us this morning has been Executive Medical Director of the St. Alphonsus Health Alliance, Dr. Sheila Giffen. Doctor, thanks so much for being here.
Thank you.